What impresses me the most about our critical care community and our ability to transport is how selfless our teams are. So it's the ability and willingness to go get patients where they're at and to bring them back to MUSC Health so that we can sustain or save their lives. So why is it essential for us to have modern modes of critical care transport in South Carolina? Because timing's of the essence. So if you think about it on the adult side or on the pediatric side, if it's trauma, and we're talking about critical blood loss, if it is a stroke, a heart attack, or something where we need to get you to your intervention as quickly as possible, the logistics of getting you from point A to point B where that specialized service is in that time frame to get you there is just essential. And so for us, that's why we have helicopters strategically located throughout the state. It's why we have well-equipped ambulances, so ground transport if we can't fly due to the weather. And so we can come and get you wherever you are, not just in South Carolina, but beyond South Carolina. And so we're not confined to just helping South Carolinians, we're helping South Carolinians and beyond. So the new helicopter is one of the largest that you can actually acquire for medical transport. And it allows us, with the additional space, to do things such as ECMO, to have more specialized equipment on board. The other thing that it's done for us as well is we have a greater range, so we don't have to stop to refuel. If we go back to timing being of the essence, you don't want to stop and refuel when you have a critically ill or injured patient in the back of the helicopter. And so if you think about it, essentially I have a flying emergency department that is there to save and sustain lives. So the two new pediatric ambulances are cutting edge, well equipped. It's essentially a ICU on wheels. And so technology changes. And also you get a lot of wear and tear on those vehicles. You always want to stay ahead of the curve and make sure that you have something that is reliable, but also has the latest technology. That technology in the back of the ambulance will save lives.
Our goal ultimately is to be an extension of the Children's Hospital. If they can do it at Shawn Jenkins, we should be able to initiate it ahead of them arriving. So that is ultimately our goal, is to try to advertise and practice as an extension of the Children's Hospital.
The future of transport for MUSC Health is very, very bright. We're not just a South Carolina entity, we are a resource for the entire Southeast. So why do patients come to MUSC Health? It's because we have the highest trained faculty, physicians, nurses, clinicians, literally in the world. So there are times that community hospitals serve our patients extremely well, but there are times where the care is so complex they have to come here. So logistically, we want to get them here quickly, and then we want to hand them off to our teams that are well-trained, ready to respond, and ready to make a difference in the lives of others.